This study looks at the impact of COVID-19 related isolation for individuals in treatment for substance use disorder. My name is Ashlin, and I'm a research assistant with the Yale School of Public Health. For some background, research has shown that supportive social networks are protective against a return to use, and individuals with substance use disorder are disproportionately affected by the COVID-19 pandemic. So for our methods for this study, we collected 24 semi-structured interviews with individuals in treatment for substance use disorder. And these interviews asked about the impact of COVID-19 on individuals' daily lives. So our results centered around two main themes: individual outcomes and access to support. The first individual outcome is negative impact on mental health. I can't move, I can't shop, I can't leave the house, I'm in prison, we're in prison, and I didn't commit no crime. That's bad, right? Didn't commit a crime and everybody's in jail. That's what I feel. Several participants compared quarantine to being in prison or jail, which suggests that they were feeling not only trapped, but punished. The next individual outcome being impact on substance use. Throughout this time of the pandemic, a lot of people have relapsed because there are no meetings and they can't, they're isolated. They can't see people. The only places that are open are like liquor stores. Importantly, this participant noted the fact that liquor stores remained open as essential business, which was also a trigger for folks when everything else was closed. The next theme being access to support. The first access to support is decreased access to supportive social networks. You can call each other, and in my meetings, you can do those online too, but nothing is quite the same, so it's things that you're missing out on that really start chipping away at you. So I'm plugged in one sense, but in another, I'm cut off. This person discussed the way virtual connection with support groups lacks something in comparison to in-person treatment. The last one being barriers to treatment access. I don't see my shrink. I haven't seen or even FaceTime with my shrink since this began, so I don't have that outlook to help me. And at the program, the counselors aren't really seeing anybody unless you're in trouble, so you're kind of left high and dry. In this case, participants felt that if they exhibited anything less than a mental health crisis, they didn't matter or they were invisible to their providers. For our discussion, we found that social support, treatment, and accessibility were three main pillars that help support individuals toward their treatment goals, and all of these were disrupted during the pandemic. And lastly, for our acknowledgments, we're incredibly grateful to our whole team, our clinic partners at SOT2 and Project Adam, and our participants for sharing their stories. And lastly, NIAAA for sponsoring our project. If you have any questions, please contact me.